So as I said that I'm actually a neonatal intensive care specialist. So many years ago at the beginning of my training, we had a newborn baby with a complex congenital heart disease who underwent multiple operations. The parents are highly educated, they are understanding, and actually this patient stayed with us for a few weeks, and the many medical and nursing staff felt very close relationship with the family as well as with the little baby. Some bought toys and engaged family that is beyond what would be perceived as a regular call of duty for a particular doctor. In other words, they become emotionally attached with the patient. Unfortunately, after one surgery, the baby developed overwhelming sepsis and multi-organ failure, and the baby continued to worsen despite all available measure. Around that time, there was actually a palpable change in the relationship between the doctors and the family. The junior and the senior doctors, even the nursing staff, who are actually very close to the family, they somehow become a bit detached from them. The ward round, which used to be at the patient's bedside, with the parents involved in the discussion, became a very short, brief encounter. Often the discussion took place in a hush-hush situation, and the parents were not really very much engaged in the decision-making process. So one day the baby died in the middle of the night, and then as a regular routine, they were informed about the patient, and the phrase that were used by the doctors, actually the baby is not doing well, when in fact the baby already died at the time. And when they arrived in the hospital, the baby actually passed away. So I happened to have a group of medical students. I actually asked them to many days later, actually many weeks later, I actually asked a group of medical students to interview the patients and parents to understand their reaction, how they dealt with this death and the dying baby. So this is some of the comments that the parents mentioned, and one was that they felt abandoned. The phrase that you said, that we felt abandoned during this process. They could sense that the patient was not doing well, and during that period of dying, they felt that they were abandoned. They also mentioned that we felt doctors were not truthful. They should have said to us that the patient is dying, but somehow they avoided the term. And finally, we missed an opportunity to say goodbye and offer final prayer to the baby. So that conversation and surrounding the death and dying about that particular patient changed my perspective a long way. And I believe that we can have a comfortable discussion about dying patient and the death with the patient as well as with their extended family member. So this will be my task to convince you that there is a methodical way of dealing these situations, and we need to be very comfortable in discussing death and dying with the patient and the family.